Welcome to 5 Minute Video Study for the NCE. We are under the clinical focus, and today we are in uh, topic X, physical emotional issues related to trauma. So, trauma is can be defined as um, a stress reaction or a response to an event or events that is one or long lasting repetitive that affects everyone differently. Some individuals can display what in the field we call post-traumatic stress disorder or PTSD, and then many more individuals can exhibit resilience response or brief symptoms as a consequence that falls, outside the diagnosis. So, whenever we're talking about trauma, it's important to understand that trauma is a spectrum depending on many variables, depending on severity, intensity, age of onset, culture. All of these issues will depend on the symptoms, whether they meet criteria according to the DSM-5, things like that. So, in order to look at this question, we have to look at some of the reactions. So, some of the initial reactions, according to the literature, can be exhaustion, confusion, sadness, anxiety, agitation, numbness, dissociation, confusion, physical arousal, and blunted affect. So that, and again, it makes sense because a lot of those sound like coping strategies where people learn or kind of are. They have to make sense of their world, so they have to take on some of these reactions. Most of responses are normal in that they affect most survivors and are socially acceptable, as well as psychologically effective and self-limited. So, again, not everyone will develop the PTSD criteria. So, again, two people can go through the same events, but their reactions could be completely different. Indicators of more severe responses include continuous distress without periods of relative calm or rest, severe disassociation symptoms, and intense intrusive recollections that continue despite a return to safety. So, again, the dysregulation, the disassociation, the really the lack of normalcy is kind of what would be a physical response. And then you also have to keep in mind that there are delayed responses to trauma. So if something happens years ago, and then there was no symptoms, and maybe 5-10 years down the road, that would be a delayed response. So those can include persistent fatigue, sleep disorders, nightmares, fear of recurrence, anxiety focused on flashbacks, depression, avoidance of emotion, activities that are associated with trauma. Substance use or substance abuse, self mutilation. Those types of reactions could be delayed, and that's what makes these issues so complicated. Is because there's no one treatment or one response path that everyone can, surely get. If A happens, then B is the response. That's certainly not the case. And as clinicians, that would be something to consider. That these are very unique things depending on the individual.